A very good morning to all the judges and Deep sir and everyone present. My name is Indrashish and I am here to present my presentation on the topic Standardization and Efficacy of Polyamor Formulation on Lipid Profile and Other Parameters in Type 2 Diabetes Mellitus. Diabetes mellitus is a metabolic cum vascular syndrome of multiple etiology characterized by chronic hyperglycemia with disturbances of carbohydrate, fat and protein metabolism resulting from defects in insulin secretion, insulin action or both, leading to changes in both small blood vessels, microangiopathy and large blood vessels, macroangiopathy. The state of chronic hyperglycemia causes secondary pathophysiological changes in multiple organ systems and give rise to comorbidities like retinopathy, nephropathy, neuro and CVDs. Traditional medicinal plants and formulations can be a wellspring for development of new pharmacotherapeutics and dietary supplements as they are considered to be relatively safe compared to the conventional drugs. Polyherbal mixture of 6 herbal extracts from Berberis aristata, Cyprus odontus, Cedrus deodara, Umbilical officinalis, Terminalia chebula, Terminalia belrica have potent anti-diabetic property and play a significant role in the treatment of diabetes. Discovery of widely used anti-hyperglycemic drug metformin also came from traditional approach of using Gallica officinalis. Root extract of Berberis aristata regulates glucose homeostasis through decreased gluconeogenesis and oxidative stress. Cyprus rodontus has ethnobotanical uses and in traditional Ayurvedic system it has been used in diabetes mellitus. Terminalia chebula exhibit anti-diabetic, renoprotective and anti-hyperlipidemic properties. Terminalia belrica has extensive properties and is used in many diseases as an antispasmodic bronchodilator and hepatoprotective, and this property was observed in alloxan-induced diabetic rats. Aims: standardization of polyherbal formulation as per WHO guidelines for quality standardized herbal formulation to develop the polyherbal formulation in capsule dosage form, to observe the effect of formulation on diabetes mellitus with the help of various biochemical parameters, to assess the hypoglycemic activity of the formulation and validate its additional claim. Materials: randomized interventional open label parallel group study. The ethical clearance was taken from the KGMU ethical department. Patients registered in the OPD of the Department of Internal Medicine and written informed consent was already been taken. Inclusion criteria: subjects in the age group of 20 to 60 years, newly diagnosed diabetes patients, subjects not taking any medication in any form. Exclusion: patients were excluded if they had type 1 diabetes, cardiovascular disease, pregnancy and interdiction to metformin, patients having several serum creatinine level more than 1.2 mg per dl, patients who had any history of taking oral hypoglycemic drugs. Polyherbal formulations standardized and formulated in capsule form of 500 mg metformin 500 mg tablets were used as test materials. Data collection: Group 1 patients were prescribed polyherbal formulation for 6 months and Group 2 were prescribed metformin for 6 months. They were evaluated and assessed in every 15 days to ensure the compliance. Patients were given diet chart and exercise counseling by the registered dietitian in medicine OPD. Study period was of 6 months and patients of both the group were followed every 2 weeks. Treatment schedule: initially 1 gram of polyherbal formulation, that is 2 capsules per day and 500 mg tablet per day of metformin was chosen as a starting dose, which was increased to 3 gram per day, 2 capsules thrice a day for polyherbal formulation and 2 gram per day for metformin. Study design: 272 patients were assessed for eligibility, then 78 were excluded, 46 not meeting the inclusion criteria, 13 declined to participate and 19 excluded on exclusion criteria. So randomly 194 patients were chosen and 98 patients were allocated to group 1 having polyherbal formulation and 96 patients were allocated to metformin having on group 2. Statistical analysis was done. Not demographic characteristics and observation: reduction in body weight at week 24 was observed in both the groups. Metformin was associated with larger reduction in body weight. Now here is a clear picture. We can clearly see that group 2 patients were having significant reduction in body weight. Glycemic efficacy: all the parameters of fasting, prandial and A1C levels were reduced in group 1 patients effectively. In group 2 patients, they were also effectively reduced. But here is a clear picture. We can see that A1C level was reduced effectively in group 1 patients and fasting was reduced in group 2 patients effectively. Lipid profile: all the parameters, especially the total cholesterol levels was reduced effectively in group 1, triglyceride and LDL level. In group 2 also it was effectively reduced, but here is a clear picture that total cholesterol was significantly reduced in group 1 and triglyceride in group 2 patients. All the other were non-significant values. Liver function test: all the parameters were again effectively managed and reduced in group 1 and both in group 2. Now comes the renal function test. Here also the Bunn ratio, creatinine level and uric acid were reduced significantly, but the values were non-significant. It is not, conclusion is not coming down. नीचे नहीं जा रहा. Conclusion: Polyamor formulation reduces FEG almost as effectively as metformin. Glycemic profile was significantly improved after 6 months of treatment in values of A1C. Polyamor formulation can effectively correct lipid profile, so total cholesterol level and triglyceride level were significantly reduced. No significant side effects were observed on both PHF and metformin. No incidence of hypoglycemia was reported, which proves that both PHF and metformin doesn't have hypoglycemia risk. That's all from my side. Thank you for patient listening.
Dr. Indrashish, you didn't mention anything about how did you randomize this patient, and when you did a study like that, you would have started with a primary objective or outcome. You have given us a lot of outcomes. Which was your primary outcome?
Actually, sir, this was the trial we were doing for just 6 months after it was done in the mice, in the rats. So we thought to just give a trial, as in our Indian setting, most of the patients don't want to go for the allopathic medicines for having diabetes or to treat diabetes. They want कि मुझे नहीं जाना, मुझे कुछ आयुर्वेदिक मिल जाए. So that was the main reason to go for this study.
No, the process of randomization. How did you randomize them between metformin and polyherbal?
Metformin is always the first line
What
of
is the technique you used for randomization? Because that would depend, I mean, a lot of outcome will depend on that.
Randomized on the basis of, actually I told that they were excluded on the criteria.
No, once the patient has agreed for the study, they would be randomized to either placebo, to the polyherbal preparation of metformin.
Yeah.
What technique did you use? Because based on that technique only, your patients will have the same.
When the patient came, first of all, we saw the fasting and prandial level, and then we told that we are doing a trial, and आप किस पे करना चाहते हो, मतलब we didn't prescribe
so it is not a randomized trial then. It is patient's wish whether he wants to go on herbal preparation or whether he wants to go on metformin. So I don't think you should use the word randomized then.
Okay.
Randomization requires a specific way in which the patient has an equal chance of being allotted to both. So maybe patients with milder diabetes have chosen to take the polyherbal preparation, and patients with more severe diabetes would have chosen metformin. So this outcome will not make any sense if you have not randomized them properly.
Was there any difference in the baseline HbA1c between the groups?
Baseline difference was not much, because it was just a 6-month study. So
no, baseline at the
baseline
time
was
of entry.
7.
Was there any difference between
to
the
7.5.
What about the GI tolerance in both the groups?
So GI tolerance was effective, and no hypoglycemia risk was also observed in polyherbal and metformin.
One question from me. You said you had analyzed 96 and 98 patients in each group, but only 74 and 76 completed the study.
Yeah.
Can you explain that?
No, 96 patients were allocated in group 2 and 98 were in polyamor formulation group 1.
But they didn't complete the study.
No, they completed. They were, so that's why 194 patients were in my study.
Okay, your slide said that only 74 and 76 completed.
No, 272 were assessed for
Not
eligibility.
200, 74 in one group, 76 in the other group,
No,
completed the study. You had a slide which
Yeah,
showed
yeah,
that,
yeah,
no?
ma'am.
Yes.
Yeah. So, ma'am, they didn't comply to the medication of polyamor.
Correct, but for your analysis you included the whole
Yeah.
initial group.
Yeah.
Can you explain that? Is that how it's usually done?
Ma'am, they didn't comply, first of all.
That's fine, that's fine. So many patients will not take, so they didn't complete the study.
Yeah.
But for your analysis, can you include them? If yes, is there any explanation for it?
We didn't included them. So, matlab,
No, your analysis, you included them.
Yeah,
What is that called?
I'm not getting, ma'am.
Okay, fine.
I'm not getting what you're telling me.
Do you know the difference between intention to treat analysis and per protocol analysis? Any?
No idea.
All right. So,
Did you have anything on treatment satisfaction at the end of the trial in the two groups,
Yes, patients, they were satisfied.
equally in both the group?
Yeah. So patients who were in group 1, they told that कि ये दवा मेरे लिए सही था and फायदा हुआ, like that.
Can I ask one last question? You said there was the difference in total cholesterol was higher in group 1 and triglyceride was higher in group 2. Do you have a rational explanation for that?
Ma'am, effective reduction was observed in both the groups, but metformin gave a little bit more reduction in triglyceride level as compared to group 1. Thank you.